We do not have specific drafted proposals because our intention was to sit down with the governor and actually talk about our ideas, putting a bill together as a whole. So what we're going to talk about today is the ideas that we support, the concepts that we want to argue for in the discussions, and hope that at the end of the day we're able to put together a package that all of Wisconsin can support, with things that potentially are poison pills from his side or things on our side that he would have concerns with, hopefully left aside, so we can try to keep as much politics out of this as possible and focus on the solutions that can actually become law. So when I looked at Governor Evers' proposals, many of them were kind of a rehash of things that we had already done in the spring. Some of those are good ideas that we certainly would want to renew, but we wanted to offer new ideas, things that have not been done before, and ideas that can help based on the input that we have gotten all across the state from our local public health departments, the hospitals, medical providers, to try to see where there are gaps in what we are doing and offer positive policy ideas for us to be able to say, here are solutions that we think we can do better for Wisconsin. One of those that we want to focus on is really the need to increase the amount of contact tracing and the ability of folks to get rapid testing. We know that one of the biggest concerns someone has is having the ability to get a test and then know the results as quickly as they possibly can, instead of having to wait at home wondering when you're going to get the email letting you know whether or not you can go back to work, whether or not your kids can go back to school, whether or not you can go back to living as normal a life as we can during COVID-19. We would like to also ask that the National Guard's testing help is extended. We'd like to make sure that we have areas where the rapid tests that were deployed in Wisconsin are deployed in a much more meaningful manner. We would like to make sure that those go out much more rapidly. We also would like to have a pilot program similar to what's being done in Minnesota, where they do more at-home testing, where you're not required in the same way to go to a testing location. There are states around the country that have done a much better job of getting the information to a person at home so they can do a rapid test, potentially get it into a testing center and get the answers quicker as opposed to having to go out. We would like to double the number of contact tracers. In discussions that we have had with our local public health agencies, we know that when somebody contracts the coronavirus, of course, a contact tracer makes an effort to reach out to them, and then in many cases, the contact tracing has to actually be done by the person who is sick, where they have to call their contacts and notify them. That is, of course, not ideal, so we'd like to have a much better organized system, not done by the state, but done by the local public health agencies, where we think that by and large they have been doing a really good job. One of the things that I did notice, which was disappointing, is that we noticed there was really no discussion of the huge problems we are having with unemployment and the fact that people still months later are not getting the unemployment that they unfortunately have to pay their bills because of restrictions put on by the federal or the state government. One of the creative ideas we would like to do is to take unemployment insurance recipients who potentially don't have the ability to go back to their former job and see if they would have the ability to go and do contact tracing, do it for a limited amount of time and be paid for it in addition to the unemployment benefits that they deserve. So we think that's a creative way to do it. We also would like to take students who are in medical school or studying public health and allow them to also become contact tracers for a semester, pay them so that we would have more folks on the ground to help deal with the pandemic, but also help educate those students going into the field and do it in a way that would allow them to get credit. We know that more resources have to go to hospitals and healthcare providers, so we do want to continue to do that. We have to figure out the appropriate way to ensure that it occurs, but we want to give more flexibility with licensure requirements. We want to also work on making sure that we have an effective distribution of that vaccine as soon as those are readily available, and figure out the process where we would be able to do it to those most in need most quickly. Struggling businesses also are an area that we want to focus on. We know that Governor Evers over the course of the summer has doled out money to some businesses and some individuals who are struggling. We'd prefer to see a targeted approach to make sure that if you have been directly impacted by the coronavirus, where you've had a reduction in either demand or in the ability to be able to pay your bills, that the state of Wisconsin would be a partner to help folks as they deal with a very tough winter. So we think that there are a lot of ideas where we can find common ground. Another area that we hope we could get some traction on, and that is having some sort of ability to protect people who are doing things as well as they can, school districts, local governments, small businesses, from the potential of lawsuits, which I know many fear right now, that they are afraid of being sued for even doing things to the best of their ability, but still having somebody else second guess their decisions and spend a whole lot of wasted time and effort on lawsuits which don't necessarily help to deal with the pandemic. So we'd like to have some kind of limited liability protections for entities that are doing their best here in Wisconsin. So we know that the restrictions that are in place, put in forward by the CDC for guidelines, are the ones that we should all follow. We know that people should wear a mask, wash their hands, socially distance when able, and try to keep social distance or social gatherings to a minimum. But we also recognize that our economy has to continue. People have to keep working, and we want to ensure that that is able to happen over the course of the next few months as the vaccine is hopefully distributed and we begin to see a turnaround in our response as a nation to the virus. So with that, we're happy to answer any questions. But today, again, Republicans want to make sure that we are very clear in our messaging. We want to find ways to work together with Governor Evers. We think that some of his ideas are certainly workable, some are not. But I think that's the point of negotiations, that we put out our best ideas, he puts out things that he supports, and we see where common ground can be found to hopefully get a bill proposed and passed as quickly as we can. So with that,
Why are you sharing these with us, not the governor?
Pardon me?
Why are you sharing these with us first and not the governor first? It's a negotiation with you guys and him. Why not talk to him first about these things?
That was our intention, but then he decided to put the bill out, which is every right for him to put the bill forward. We wanted to just... No, because we just wanted to talk about broad concepts. We do not have bill language drafted. We do not have specific provisions that we're offering like he does. But I do think it's important that as he has news conferences 2 to 3 times a week, and he should, that Assembly Republicans also have the chance to go out and talk about the things that we are for and the things that we want to do, which is why we're here today.
When do you want to pass the bill?
I'm hoping to do it as soon as possible. If we could find a way to have common ground, I'd certainly be open to coming in December, if that's possible. But when I see the proposals that he had, they were mostly paid for by state dollars, which certainly I would prefer to use the Federal CARES Act, which of course has to happen by the end of the year.
Right.
Yes?
For the people who've been suffering through this for 8 months, today we recorded the highest number of deaths in the state. You don't have a bill. You just have ideas you want to talk about after 8 months. How can you say we've been working on this all along and we haven't got anything to show for it?
Oh, we do. I mean, we have those exact ideas. But the whole point is that as we have gone through the summer, the Democrats have spent tens of millions of dollars lying about our records, saying that, we didn't care about COVID, and that, of course, is not true. But what we did want to do is we've tried to put politics in the past. We wanted to say, let's sit down and negotiate in good faith so we have an opportunity to put the best ideas forward, not say, like, here's the way we have to do it, here's the way that we other have to do it. We've been saying pretty much throughout the entire summer we should not have a Democrat plan and a Republican plan. We should have a plan that we can agree on together. So that's the hope for us, to be able to sit down as quickly as possible, put the best ideas on the table, draft a bill, and then bring it forward for a vote.
What prevented you from doing that before this one?
Well, the political season that we were in allowed people to be able to go through the process. And again, all the ideas that we are bringing forward today are things that can actually happen. There's no doubt about it that now politics shouldn't be part of it. It should allow us to put the best ideas forward. I don't think Democrats were necessarily sincere in wanting to be able to have a discussion about a lot of these topics because they were in the middle of their allies spending tens of millions of dollars lying about our record. That's behind us now. Governor Evers is the governor, and the legislature is controlled by Republicans. We've got to figure a way to get this done, and that's why we are trying to be sincere today and saying, here are some good ideas. We think potentially he has good ideas as well, and we can find that common ground. I'm sorry, I couldn't understand you.
Last week you said you wanted to sit down and meet with the governor after this address. So when are you going to meet? Is there anything on the books right now?
Yeah, that's what our staffs are working out. Our hope was to meet this week so that we had the ability to come back and try to have something negotiated by Thanksgiving so we could hopefully go in December. That was our internal timeline. We'll have to see if that's possible based on the actions that he took today.
The governor's office says he has availability on Friday starting at 9 in the morning. Is that going to work for you, Speaker?
I mean, we're always open to looking at it, sure. I mean, I'm happy to talk anytime, anywhere. We've been saying that for a while. But again, the goal is for us to find that common ground so it's not just a political discussion where each side goes back to their corners. I want to find things that we can actually agree on. So I hope that he's sincere, and I am too.
But the message from you today is that the governor of this bill has threatened these negotiations. The message from his office is that you guys calling a news conference before meeting with him and answering his request threats of negotiations. So how can we have faith you guys reach a deal with the broken relationship we've seen for the last 2 years and this action today about a bill to address COVID-19?
So what I believe is that for people who read WisPolitics and people who are kind of political insiders, that's an interesting question. For the rest of the state, is they want us to say, don't focus on who's fighting with who, don't focus on who's going to meet what time, when, where. Nobody cares. What they want is they want us to find answers where we can actually move the ball forward and be able to find things that can help those who are dealing with the coronavirus. I'm focused on making sure we have more contact tracers because we have failed so far. I am focused on making sure we have more resources for small businesses because those small businesses are suffering. I'm focused on making sure that we get testing and having the ability for people to get a rapid result so they know if they can go back to their job. Those are the things that people care about, and that's what we're going to focus on, not the internal of what time are we going to meet, where are you going to meet, how's it all going to work. Nobody cares about that.
Do you really think that nobody cares when you're going to meet with the governor to get something done? Do you really think no one in the state cares about that?
No, I think they care about the results. The time that we meet, the time frame, all of those kind of things. They want to see results actually happen.
But there's been 8 months and we haven't seen results. So it seems kind of closed-minded to believe that people don't want to see you guys actually meet and create that change that you're talking about.
No, we're going to meet. The question that comes down to it is, if you as the mainstream media spend all of your time focusing on, are you meeting on Friday morning or Monday morning or Tuesday? That's all irrelevant to the public. What they want is the results that we are proposing today. So if your story ends up being, oh, what time are they meeting? Nobody cares about that. How about if we focus the story on saying we want to have more contact tracing, we want more people to have access to testing, we want to make sure that we have the resources that are necessary. Those are the things that the average person who is reading or watching any of the newscasts cares about. They don't necessarily care about the machinations of internal political arguments. They want to see the results that we are focused on trying to get, hopefully, by the end of the year.
But those are the things that people have wanted to see for months. Have you had any discussions? Has there been any progress to this one?
Yeah, we have actually had progress. I mean, we are working through our own internal process to make sure that we have the ability to offer ideas that are going to do something. Many of the things that Governor Evers put on the table, not bad ideas, but they were things that we had already done in the spring. So from my perspective, what we have been doing so far has not been anywhere near enough. He's kind of double down on more of the same. I would like to have new ideas that are out there. What are things that we could do that are better and different, that are going to result in something that is not the same as we have seen over the course of the past 6 months?
Which of the governor's proposals do you support, and which are guaranteed not to pass your chamber?
So I want to go in and have a discussion that is about all of the issues, right? I think it's very unlikely that we are going to say you don't have to pay your rent until sometime in 2021, right? That's probably not something we're looking to say. It's okay to not pay your rent. That wouldn't be good for our economy. But I also want to hear what the rationale is and at least give them the due deference to say, here are why we think some of our ideas are good to look at. Right? So I don't want to instantly say that there are things that are dead on arrival. There are things that I look at and say, I think our caucus would have a hard time supporting that. I think that there is way too much spending in this bill paid for by state taxpayer dollars when we have federal CARES dollars that could still be allocated. Makes no sense to not spend federal money first. But I'd like to at least hear the rationale why they'd like to do that.
So I'm not sure. A couple of points that you guys do agree on right now, that you can tell us, hey, this is the point that we and the governor are both in agreement on, and we want to start moving forward with those points that you said.
So I'm not going to negotiate in the public. I would prefer to refer to the governor and allow us to have that discussion to see where there's areas of common ground. Just like I said, I'm not going to say automatically every one of his ideas or any of his ideas are dead. I'm also not going to say that every one that he's fleshed out where we only know a little bit of the details, that we're going to say, yep, that's when we can definitely say yes to until we have a chance to talk about it.
So the CARES money has to be spent by the end of the year.
Mm-hmm.
You want to do more contact tracing, presumably you want to continue to do that after January 1st.
Sure.
So how much state money would you be willing to put in 2021, given that you have no more federal dollars after the 31st of December?
Yeah, well, a lot of it depends on what happens at the federal government. I think in the end, I believe there will be another coronavirus relief package at the federal level. What it covers, how it all works, I don't know that yet. But I would prefer to spend state dollars last, not first. And I think that's important for us as we look at what we're going to do to fund schools next year and what we're going to do to fund all of state government without raising taxes. So for us, we want to find a balance. So we certainly are willing to spend some state resources on things that are important, but I'd prefer to spend federal dollars first.
Do you want to keep the suspension of the 1-week waiting period for UI benefits open until the end of 2021?
I think we have to look at that. I mean, the one thing that we did originally was to try to guarantee that in a huge pandemic where there was a massive spike in unemployment, no one would have a problem getting the benefits. We now see, frankly, in many ways, the other problem is real, where many employers, because either folks have been quarantined or they are forced to do a change in their life, there's a real rise in the number of openings all across the state. So we actually see the opposite problem, where we need people to work in a lot of the essential jobs that are out there where people are not able to be part of the process. So I think the issue with unemployment isn't the same as it was in the spring, but we'd certainly have to take a look and talk with the governor about it.
Robin, I don't understand this. So you just said you're not going to negotiate in public. You called us here to lay down your position on what's needed in the COVID bill. How is that not negotiating in public?
No, so what we wanted to do is we wanted to offer new ideas that no one else is talking about, that we could say, these are good things that the people of Wisconsin should know about, right? Governor Evers has been basically doing the same thing, the same way, since April, because if you remember, and even though the Democrats, again, don't want to really talk about it, we really empowered the governor to do a lot of these things over the course of the past 8 months on his own. He had the ability to unilaterally move people around in state government to make the unemployment system one of the best in the country. Instead, we have abjectly failed. He had the ability to move people around to be contact tracers all throughout the state. And again, that's not happening. If you talk to local public health agencies, they will say that the flexibilities that were given really were not utilized. So that's the decisions that he's been making. What we'd like to do is to say, look, we can continue to rehash that and try to do more of the same. We wanted to put ideas out there that we think are good ones to be able to say, here are things that we'd like to have as part of a negotiation because they're new, they're innovative, they solve a problem, and hopefully at the end of the day, they can be bipartisan.
All right, thanks, everyone.
Thank you.
What do you see from the federal government to help you guys actually execute this?
I'm not at the federal level.
What do you want to see?
I mean, it seems to me that the continuation of some of the things that they have given us, the ability to have funding for the National Guard, the ability for us to do that contact tracing. I mean, I want to thank the president for making sure that we had over 1.7 million rapid tests in Wisconsin. Those are the kind of things that we need going forward. It's not necessarily just an open checkbook, but certainly the access to resources to guarantee that we're going to have contact tracing, testing, and hopefully help for small business. Okay, thank you. Thank you.
That might be an interesting question for just politics. Yeah.
Yeah.